Hi, Dr. Stewart here in my home lab, my little office at home. I'm going to do some demonstrations of some pulmonary function testing and calculation of some values to help describe these things and help you understand what's going on. It should help you both with your lab practical that will come up in a couple of weeks, which is the pulmonary and digestive systems, because we'll have a couple of questions from these labs on there, and also hopefully help strengthen your understanding of some of the lung volumes that will show up on your lecture exam. What you could do first, if you want, is there. I have a lab data sheet that I have put on your Canvas site, and this is pulmonary function. It'll be called pulmonary data sheet or something like that. We're going to use the first two pages. This one has a couple of calculations here at the bottom that we're going to go through. Here's the data collection from the test that I'll be doing later. We'll do the forced vital capacity and FEV1 using the BioPac rather than using a spirometer, because my good old trusty spirometer is good and old and doesn't show on the computer well. So that's okay. We'll do it on this the best we can. The last page we're going to not worry about. These are some extra exercises that we do in live labs that are interesting and give everybody plenty of things to do in the lab, but we won't be doing those today. So I'm going to do this as kind of a three-parter. This camera thing, where I can show you what I'm doing, I'm going to do that. Then I'm going to cut that one off. I'm going to do the data collection on the BioPac system, which will show up only on the computer screen. You won't see me while that's going on, which is no terrible thing for you. And then I'll come back and do a third short video where we actually crunch the data, and I'll show you how we get the numbers that we get. So what I'm doing with the BioPac system is typical pulmonary function testing. A pulmonary function test, or PFC, which is what it's called, is a way to tell if your lungs are behaving the way they should. If you are having some kind of an attack, if you have COPD, if you have asthma, if you have allergies or whatever, this will help pick those up. And so in the most basic pulmonary function test, which most of you will probably do or administer sometime in your life, you set up the machine. The person takes the biggest breath they can possibly take. They put the thing in their mouth and they blow all the air out as hard and long and fast as they can. I mean, they try to get it out quick, but also keep blowing until the room starts to spin. And then inhale and show the inspiratory curve as well. And you get that nice little curve that we have that looks like this, where you blow out the air and then you suck it back in. And the numbers it gives you will show if you're about right for your height and weight and gender. Caucasian males have the biggest lungs. So my predicted values are fairly high. So you have to know whether you're doing a Caucasian male or a black female, because the expectations are going to be different. So it will look something like this if you're doing it in real life. You might put a nose clip on so no air comes out your nose. You take this deep breath and then you blow and then pull it back in. So I'll kind of demonstrate what it would look like. All the way out, all the way back in. And what it does is give you a forced vital capacity reading, because you forced it. I sucked in as much as I could suck in. I blew out as much as I could blow out. So it is a measurement of my vital capacity, but I've forced both extremes to get the biggest vital capacity I was able to produce, the FVC test. And if your machine is set up so you can tell how much came out in the first second of that test, remember 80% of your air should come out during the first second of blowing. It comes out really fast at first, and then it slows down. But 80% should come out really quickly. If it doesn't, your lungs are not exactly clear, or your airways are collapsing a little bit too soon. You may have asthma, you may have an allergy. If I had somebody with a FEV1 of 70% instead of 80%, I would say, are you feeling okay? Are you having any allergies? Oh yeah, this time of year, pollen. Okay, that's fine. It would be expected. But if there's no other reason to have slow airflow, and you have an FEV1 of like 60%, that's kind of low. So you might check and see if the person is having some kind of lung injury or difficulties going on. The other thing you get is the peak expiratory flow. At the fastest point of airflow, it should be going pretty fast. I think I said something like, 300 to 600 liters per minute. That kind of an airflow would make sense. Maybe for somebody my size, somewhere between 4 and 6 liters per second, something like that would be an expected airflow rate when I'm blowing as hard as I can. Again, if it's a lot slower than that, you may have some obstruction going on. So I'm going to do the pulmonary function test. I'm going to do a bunch of calculations, and I'll put them on bigger sheets so you can see them better. This first calculation on the bottom of your sheet here, this is a way to calculate what my vital capacity should be. So once I do it, you can say, well, is that good or not? I don't know. How big is he? How old is he? Is he a Caucasian male? Is he, what is he? If you can calculate the predicted, then you can see whether you've met your predicted values or not. Now, most spirometers will give you a column that these are your predicted values and these are what we actually measure. How do you measure up? Does it look like you're okay? But in this case, I'm doing this thing down here. This is for a white male. My vital capacity, 0.052 times height minus 0.22 times age minus 360. It's a little bit of a pain in the neck if you have to do it this way. And of course, this is backwards, so you have to bear with me here. But here I did 0.052 times my height, which is 184 centimeters. I calculated my height in centimeters, and that gives me a number of 9.5. 0.022 times my age, which is 69, I'm horrified to say. That's 1.5, approximately. It's real close to that. So 9.5 minus 1.5 is 8. So 8 liters minus 360, which is a constant, gives me an expected vital capacity of 4.4 liters. So when I actually do the test for you guys, we'll see if I can do at least 4.4 liters. If not, my lungs aren't functioning really up to par for my age. Now, for 4.3 would probably be fine, but 3.9 would not. That's a little bit too low compared to what I should get for my height, my age, my gender, and so forth. Okay, I think that's what we can do here. I'm going to stop this video. I'm going to put in the second video, which is the actual data collection, and then I'll come back with a third video where we deal with the numbers.